Handling patients over the telephone or at the front desk is a fundamental task of any medical receptionist's job. Sometimes it can be difficult to determine the level of urgency for each patient. A patient may telephone and say they need to see a doctor urgently. This may not be possible because the GPs are booked out either for the morning or even for the day, or in some circumstances, for a couple of days. It is important that you determine if it is an urgent matter. For instance, a patient may telephone and say they have a sore arm and they need to see a GP urgently. After investigating the patient's concerns, you may find out that the patient has had a sore arm for 5 months. This is probably not an urgent case, but it is really important that you check the triage pop-ups. Alternatively, you may have an elderly person on the telephone who says, "I've just been having a bit of pain down my arm. I think it might be a torn muscle. It's been going on and off all night. I don't mind when I see the doctor." This case could be really urgent. The patient might be having some kind of cardiac problem, so then the patient really needs to come in that day. It is vital that you understand the importance of triaging people at the front desk. Make sure that you get training from your practice nurse, your GP, or your practice manager prior to taking telephone calls at the front desk. If you are unsure how to handle a clinical emergency, always ask for help immediately. Speak to your practice nurse, GP, or practice manager. Sometimes you might have a patient on the telephone who is distressed. It might be somebody going through a mental health issue, a marriage problem. There might be children screaming in the background. If you are busy at the front desk and unable to pay full attention to the telephone call, ask your practice manager or the practice nurse for help. Try to identify with the patient what their distress is before putting the telephone call through.